Hello and thanks for joining us on Chicago Tonight. I'm Brandis Friedman. Here's what we're looking at.
The state has been a willing partner at every single turn.
Chicago Public Schools has to close a huge budget gap by the end of the month. Lawmakers weigh in on the district's financial challenges.
This is a community disaster.
And local reaction to the shutdown of Weiss Hospital in Uptown. First off tonight, some of today's top stories. Texas state lawmakers are into their second week of a quorum break after fleeing their home state for Illinois and New York. Today, the group of Democrats joined some Illinois Congress members to call out their Republican colleagues in Texas for trying to add 5 more GOP-leaning seats in the U.S. House.
It's for parents who want to send their kids to a safe school. It's for women who want to have access to health care. It's for our retirees who just want to retire with dignity. It's to protect Social Security. Texas Democrats are standing for fair maps. We're standing for fair wages and fair chances.
The Democrats claim the GOP redistricting plan would eliminate Hispanic opportunity districts in major Texas cities. Meanwhile, Texas Governor Greg Abbott and Attorney General Ken Paxton are pushing for the Democrats' arrest and a return to Texas to complete the vote before the current special session ends next week. After announcing plans to place Washington, D.C.'s police department under federal control, President Donald Trump suggested doing the same for other cities, including Chicago.
We have other cities also that are bad, very bad. You look at Chicago, how bad it is. You look at Los Angeles, how bad it is. We have other cities that are very bad. New York has a problem. We're not going to let it happen. We're not going to lose our cities over this. And this will go further. We're starting very strongly with D.C., and we're going to clean it up real quick.
Under the Home Rule Act, the administration says it's declaring a crime emergency and activating 800 members of the National Guard to make the city safer. But police stats show violent crime in D.C. is actually down 26% compared to this time last year. And in a statement, Chicago Mayor Brandon Johnson responded, quote, "Last week, we learned that President Trump cut another $158 million in funding for violence prevention programs in cities like Chicago. These cuts are on top of the Trump administration dismantling the Office of Gun Violence Prevention and terminating more than $800 million in grants for anti-violence programs across the country." He goes on to say if President Trump wants to help make Chicago safer, he can start by releasing the funds for anti-violence programs that have been critical to our work to drive down crime and violence. Sending in the National Guard would only serve to destabilize our city and undermine our public safety efforts. Some of Chicago's pools are beginning to close despite that persistent summer heat. The Chicago Park District says it's closing city pools in phases as many of the student-aged lifeguards are heading back to school this month. 15 indoor and outdoor pools across the city closed yesterday, with another 42 set to close this Sunday. But don't worry, you can still get some water time in because all 22 lakefront beaches and another 19 neighborhood pools will remain open through Labor Day. You can find a schedule of when your local pool closes on our website. Up next, breaking down Chicago schools' budget shortfall as a looming deadline nears. Right after this.
Chicago Tonight is made possible in part by the Alexandra and John Nichols family, the Jim and Kay Mabey family, the Polk Brothers Foundation, and the support of these donors.
Chicago Public School students and teachers are preparing to return to the classrooms with the first day of school just a week away. But the district already has some important homework to complete as it faces an eye-popping $734 million deficit. The district has until the end of the month to pass a budget, but as CPS officials are calling on leaders in Springfield for more funding, some lawmakers are questioning the state's responsibility in paying up. Joining us now are State Representative Ann Williams, a Democrat representing parts of Chicago's North Side, and State Representative Curtis Tarver, a Democrat representing parts of Chicago's South Side. Thanks to you both for joining us.
Thank you.
So, Representative Williams, let's start with you. CPS CEO Macklin King and members of the school board have said that the district is out of options with regards to raising revenue or cutting costs. Does the state have any responsibility to intervene and provide more funding?
Brandis, of course the state will have a very critical role in providing funding, not just for Chicago Public Schools, but for districts throughout the state. And Dr. King is right when she says we need to put more money towards schools. But exactly how that happens really depends on what we see on Wednesday when CPS does release its budget.
Representative Tarver, you introduced a bill back in the spring legislative session to bring back state control of CPS, the School Finance Authority that expired back in 2010. But now you've said a full takeover is not necessarily a feasible option. What changed for you?
Well, I actually had a chance to talk to the former comptroller who was around at that time yesterday, and he told me that they used to have to literally fly checks to CPS, millions of dollars. And so they had no ability to bond. They really have any access to markets. I think we're in a slightly better position in that regard, but I do think there still needs to be a role for the state to implement some reform if we're going to send those funds to CPS.
Representative Williams, you said, it'll kind of depend on what we see from CPS when they do present their budget. Of course, they're not expected to pass that until later on this month at their scheduled board meeting. What do you need to see? What would you like to see?
Well, I think it's important that the budget reflect what we're hearing from everyday Chicagoans and what I've heard from my elected school board members. Basically, we don't want to do anything that's going to negatively impact the classroom, first and foremost. And secondly, I think it's important that we look long-term at the fiscal stability of CPS. It's important not just to Chicago residents, but to residents throughout the state that Chicago does well, and specifically, Chicago public schools thrive and grow. We are the economic driver for the state.
Representative Tarver, same question to you. What do you need to see from CPS?
Well, look, I need to see a lot of changes for CPS. CPS is still testing 4-year-olds for a handful of schools, not really releasing the information what's on those tests. CPS has had on their, they had a resolution since 2005. They will look at how to remap schools. Certainly should do that given the influx of students who've come in. There may be some ways to save money by looking at those remaps. In addition, when it starts at the top, when you look at the general counsel who paid an expert to say that not all sexual assault of a child is traumatic, I have really some concerns about what's happening at CPS. And so I would like to see quite a few changes. And I think there's precedent for that. When you look at the transit, there's been conversations about not just sending funds to the CTA or the RTA without some kind of additional oversight.
If a reinstatement of a school finance authority were to be on the table, what would that look like?
It's a good question. I think that, as it was said in the committee hearing, there's a way to calibrate it to make it make sense for both the state and the city. One of the things that I think is important to note is that the EBF funds that go to CPS are different from the way they're funded.
EBF, of course, the evidence-based funding formula.
Yes. CPS gets theirs and they decide how to spend it, right? Everybody else is told how to spend it through that formula. And so that would be one thing that I like to see. There's been bills filed for that probably every single year that I've been in the General Assembly.
Okay, and I want to come back to that as well, as far as how CPS doles out its funds to schools. Representative Williams, I've often heard when covering CPS that it's not just that everybody needs a bigger piece of the pie, it's that we need a bigger pie. How can the state increase the amount of education funding that it provides across the state, not just to CPS, of course?
Well, I couldn't agree with you more, and I think we're hearing that every day from our constituents, not just in Chicago, but everywhere. But I think it's important to note that there are some structural inequities built into how schools are funded. For example, Chicago Public Schools pay for most of their own pension payment, whereas schools throughout the rest of the state contributes more. I think the number is $4,000 per pupil. For the rest of the state, Chicago only gets $1,000 per pupil. So that's the kind of longer-term conversation I think we need to have, in addition to short-term, how we handle the funding inequities now in today's budget discussion.
And I imagine there were historic arguments made at the time for why that deal was made, why CPS is only getting $1,000 compared to $4,000 and other expenses across the CPS budget.
Absolutely. Actually, it dates back to the 1800s when CPS was the only pension game in town. Later, I think 30s or 40s, school districts from the rest of the state pooled their resources and the state funded their pensions. We didn't provide any money toward pensions until 2017 when we did the school funding reform. So we did a little bit then, we need to do more.
Among the reforms that you're suggesting, Representative Tarver, one of them is that the district adopts an equity-based funding formula. Last year before, I'm not sure, CPS announced plans to shift away from student-based budgeting, which had been the long-time practice of the district. How does a different funding formula for CPS, how do you think that'll impact student outcomes?
Well, I'll tell you, you should tie some of those things to student outcomes. You know, when I look at churches like Progressive and Salem that spend hundreds of thousands of dollars over the summer to teach black boys how to read in the Black Boy Literacy Program, there's a problem when community organizations and churches have to do that, and CPS is not doing that. The fact that, you know, is that if little boys cannot read, they're certainly more likely to end up in prison. And so that would be one of the things that I would like to see again, actual outcomes tied to those funds, not just sending it to certain neighborhoods and schools, but actual outcomes tied to those funds.
Any particular outcomes you've got in mind, like test scores or reading levels,
I would
graduation
like
levels?
to see kids at least reading their grade level. That would be a minimum to me.
Some basics.
Yeah.
Okay. A partnership between the district, city, and the state that was also mentioned at as a potential solution at the hearing that you all held for the executive committee a few weeks ago. What would that partnership look like? Why hasn't that already happened?
Well, I want to say this, and I think Leader Williams would agree with me. The state has been at the table, right? There's been a lot of talk about the state not being at the table. We've been at the table. I think that the partnership will look very much like not just simply having the board itself making every single decision, because it's a hybrid board. What was fought for was a fully elected school board, right? Because of mayoral control. And now we have the same thing in many regards. So again, the state putting more money into the kitty, the state should have more conversation about how those funds are spent. And there has to be a community aspect to it. There just has to be.
How unwieldy a conversation do you think that might get with a 21-member board?
I think the board already is unwieldy.
Okay, so that sounds like a conversation we're going to have you come back and say more on. Representative Williams, the school district facing that deadline this month, as we mentioned, to pass a balanced budget. Do you think they'll be able to achieve that?
Well, I think it's important to note it's not all bad news here. We have made progress, as my colleague referenced. We did, the evidence-based formula does work. It provides more funds to the schools that need it most. And I think it's also, I'm optimistic. It's also important to note that we are seeing improved student outcomes in CPS, which is really something to be proud of. So I'm optimistic and hopeful that on Wednesday we'll see a budget that's responsible, looks forward, and really reflects communities' concerns.
You say the evidence-based formula, it's supposed to reach adequacy by 2027. Do you think that's going to happen?
Hey, we are working our way forward. We're getting there. We may be a little bit behind, but we also dealt with a pandemic just a few years ago. But we are committed to doing what we can to make sure not only the school fund is funded at the level it is now, but that we provide more funds for schools throughout the state. I'm hopeful that will happen.
All right, Representatives Ann Williams and Curtis Tarver, thank you both. Good luck to you.
Thank you.
Appreciate it. And we're back with more right after this. We'll get back to our program in just 2 minutes for our conversation about hospital closings. But I wanted to take a moment to talk with you about something I believe is very important, and that's the independent journalism we bring to you each and every night. Federal funding for public broadcasting has been eliminated. This loss is real, and it will have a serious impact across the country and here at WTTW. That funding helped us provide essential programs and services like Chicago Tonight, as well as the PBS NewsHour, educational outreach, PBS Kids programming, and much more. We're asking viewers to become members to continue the essential work we do. When you become a member today, Your contribution will be doubled through a generous matching grant. You can help us with a donation of any size by calling 773-588-1111, by going to WTTW.com or scanning the QR code on your screen. Thank you for always standing with us. You know, for generations, your support has made something extraordinary possible. Commercial-free access for everyone in your family and our community to trusted news, inspiring stories, and educational programs that have shaped millions of lives. At WTTW News, we bring you independent journalism, which is essential to our democratic society. We're responsible not to corporate interests, but to you, our viewers. And we work hard to combat misinformation and disinformation. We provide fact-based reporting that lets you decide how to use that information. We tackle complex topics and information because we respect you, our audience. We need your help to not just survive, but to thrive. If you are already a donor, thank you. And if you're not, double your impact with your donation to WTTW by calling 773-588-1111, going to WTTW.com or scanning the QR code on your screen. Because what we built together isn't just worth preserving, it's worth strengthening. We're moving forward with you at the heart of it. We hope you find value in what we do here at WTTW News, Chicago Tonight, and throughout the day and night on WTTW.com. Please consider supporting us at whatever level is best for you. We are in this together, so thank you. Chicago Tonight returns in just a moment. Two Chicago area hospitals are at risk of shutting their doors completely. Weiss Memorial Hospital in Uptown closed last week just before its agreement with the Medicare and Medicaid system was set to lapse. And Oak Park's West Suburban Medical Center is facing a similar fate. Here's the scene from last Friday's rally outside of Weiss.
We're here today because this is sacred ground. This hospital is where many of our community members were born, and also where many of our community members have passed on. We're here today because we cannot allow this hospital to be closed. This is a community disaster.
And this all comes on the heels of federal cuts to Medicare and Medicaid, which these hospitals depend on. But some community members argue that's not the only problem. Joining us now with more are Lily Lay, the Community Organizing Director of the Vietnamese Association of Illinois, Uptown resident and longtime Weiss Hospital patient Kim Nam, and via Zoom, State Representative Han Nguyen, whose 13th district includes Uptown. Now, we also invited Weiss Memorial Hospital and West Suburban Medical Center to join us, but we have not heard back. I thank the three of you for joining us. So Lily, Weiss and West Suburban, they're both classified as safety net hospitals, primarily serving low-income communities. Weiss also serves a large portion of the city's Vietnamese community. Where are patients supposed to go now that most of Weiss's operations are closed?
It's really uncertain, and I think that's why we're worried and why this situation is so dire, because in the short term, right, there's been Band-Aid solutions that have been suggested by the management, which also has not been communicating well with its patients and with our community. In fact, they were really late to inform the elected officials, the community members about the funding cut that just passed. The deadline for the funding cut. Yeah, and so while in the short term, right, people are being transferred out and they're only providing outpatient services, in the long term, there's a lot of concern about how to maintain access to affordable health care to most vulnerable folks in our community, such as our seniors, low-income folks, and immigrants.
Ms. Kim, you are a longtime resident of Uptown, a patient of Weiss. You gave birth to all three of your children there. What was your reaction when you learned that it'd be closing?
I was worried, upset, it's not happy. So because I have my three children was born there, And even I have the see the outpatient with Dr. Sabakan still until now. And so my next appointment is not next, will be tomorrow.
You have an appointment tomorrow?
Tomorrow, but because Weiss has the part is next to the building, to Weiss Hospital, they still the office, so we still continue to see the outpatient there.
So you can still get VAT serviced. Have you received any other communication about the hospital closing?
No, they don't.
None.
Yeah, so I just found out it's about a week. Yeah, it's from the Vietnamese Association, so it's a very hurry. So bad and so bad. It's like the time we don't have any preparing anything.
No time to prepare.
Right.
Yeah. Representative Nguyen, you have a personal connection to Weiss as well. As a refugee, tell us about the significance of the hospital to you, but also to the community.
Absolutely. Thank you so much, Brandis. It's a pleasure to be here today. And I think this, as has been illustrated by Lily and Ms. Kim, it's been very detrimental to our immigrant and refugees community. This hospital has served in the Uptown neighborhood for the last 70 plus years, and it's really been a refuge for folks to come for emergency services, for healthcare services, for preventive care. And so, we've seen really this management has failed on all respects when it comes to taking care of internal operations. And we're seeing this play out when we're seeing the loss of jobs as well in this neighborhood for our nurses, for our frontline workers, and for our doctors. So this hospital means a lot to me. It means a lot to the immigrant refugee community. I myself am a refugee from Vietnam as well, and have also been a patient of this hospital. So we are certainly feeling the devastation right now for our working class families, for our seniors, and for our communities of color right now across the North Side Lakefront.
Representative, you've said that the hospital's CEO, Dr. Manoj Prasad of Resilience Healthcare, he also owns West Suburban Medical Center. You say that he's mismanaged the hospital. How so?
Yeah, we have seen through the last couple of cycles of mismanagement at this hospital. When we had federal regulators come in and survey the hospital, they found violations when it comes to nursing staffing needs, when it comes to public health conditions, when it comes to food safety and food handling regulations as well. And so we have heard this from patients on the ground who have suffered in this hospital. And the other thing I want to say is this is also a multi-dimensional problem. And not only is the hospital mismanaged, but is also in this moment in time when we have an administration that is shutting down healthcare facilities across this country with the big ugly bill that is gonna really target our vulnerable communities in blue states. And so we're seeing, again, the removal of another healthcare facility that's gonna exacerbate the damage that's been done already by MAGA Republicans, and that's gonna further weaken the healthcare system as well.
I want to mention that we did reach out to Dr. Prasad of Resilience Healthcare in the hospitals. We have not heard back from them just yet. Lily, what other ways do you think the doctor and the hospital leadership could be keeping the hospitals open?
Oh, that's definitely many possibilities, right? First of all, I just want to name that this is a situation that has already happened to another hospital in the past, Mercy Hospital in Bronzeville, and it was a very similar scenario, but that's when the community, the union, hospital staff, and elected officials in the area, right, all came together to save that hospital, and now it's fully operational as Insight Hospital. And I think the same, right, efforts and urgency is required in this situation too. Again, like Representative Nguyen said, this is a preventable situation and also still a situation that can be fixed. And it's very important, right, that Dr. Prasad does what is very well within his power to save the hospital right now, and also that the federal government, our U.S. representatives and senators, Representative Schakowsky, Senator Durbin, Senator Duckworth, right, that they have the power to intervene with the Center for Medicare and Medicaid Services and make sure that, you know, this situation is remedied.
Ms. Kim, do you know yet where you'll receive medical care from?
I don't know yet. So because they too quickly, and then so I did not think about it yet.
So you
but
haven't had the chance to think
yeah,
about
I
it.
don't have that. And then, but tomorrow for my appointment, so I will like continue to ask the doctor or what they will give me any like opinion they will give me, or maybe I can go to
suggestions or
another
referrals
suggestion too. Yeah.
Of places that you can go.
Yes.
Representative Huynh, we've got about 30 seconds left. What are you doing at the state level to address this issue? What can you do?
Yes, at the state level, we are looking at all solutions right now. We have allocated additional funding to Weiss Hospital in this year's budget. So we are looking at that to make sure that those changes and improvements are being made right now at Weiss Hospital. And then we would have to work with Weiss Hospital and management, preferably new management, to make sure that we apply for federal Medicare funding again.
Okay.
So that's something
Best
that
of
we're
luck.
looking at right now.
Okay, and that's I appreciate it. That is where we'll actually have to leave it. But best of luck in the work that you do on that. And my thanks to all three of you, Representative Han Huynh, Ms. Kim Nam, and Lily Lay. Thank you. And that is our show for this Monday night. Join us tomorrow night at 5:30 and 10. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thanks for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a personal injury law firm working to preserve the dignity and rights of all individuals.